Today's topic is medical ethics, Hindu perspective. And it's a very exhaustive topic. Probably finish in about a couple of sessions, but at least the major session I'll start today. Really speaking, in our scriptures, specifically written in the Ayurveda, which is Hindu medicine or science of life, certain principles pertaining to the Hindu ethics have been laid down. And these are based upon the practical values of ahimsa, non-hurtfulness, 2, sanctity of life, 3, existence of the soul which is separate from body, and 4, a willingness to accept life circumstances as defined by one's karma and one's dharma. That means the duty and the net results of good and not so good actions in life is karma, which I'll come to that in greater detail later. And what I would suggest is those who are interested in getting complete notes of this morning's discussion, if you just write down your address for me, email address to me, I'll send it to you, the notes from this particular day's discussion. So if you can pass it on, that's all. They can pass it on by the end of the day. I collect it and I'll send it to you. Now, when I tried to review this topic, I started approximately in 1992. And that was following a careful study which was compiled by late Sadguru Guru Subramania Swami from Kauai, who addressed these problem areas pertaining to Hindu ethics, problem areas in our life based upon the Hindu ethics, and frequently encountered by the physician following a request from the Texas Medical School to him. And he consulted Virendra Sodhi, who is a physician, both allopathic physician like me and also an Ayurvedic physician. He practiced in Washington, D.C. And he also talked with Professor Cromwell Crawford, who is born in India, but is a specialist in Hindu medical ethics, who worked at the University of Hawaii. But he took input from several spiritual scholars, some of whom are no longer alive, but at that time. He got help from Swami Nathananda from Ramakrishna Mission. He is no longer alive. Swami Tejomayananda from Chinmaya Mission, he is just coming on board. Swami Chidananda Saraswati Muniji, Paramartha Niketan, Rishikesh, whom I met in June myself. Swami Buvaji, who at that time was teaching yoga in New York and of course grew up in India, and finally passed away at the age of 121. Swami Satchidananda, disciple of Swami Shivananda, immediately followed Swami Shivananda from Rishikesh. He passed away in 2002 at the age of 88. Swami Omkarananta Balayogi, he got Diksha and recognized as an enlightened person at the age of 14 by Swami Shivananda and worked with him for many years. Swami Prajnananda, who is a relatively young man who popularized the Kriya Yoga around the country. And last but not least, Sadguru Bodhinatha, Swami Subramania Swami's successor in Kauai Monastery, whom I plan to meet in about a couple more weeks. Now, this group of advisors came up with certain suggestions, which I'm going to summarize. But if you go back, the foundation of these suggestions is based upon the codifiers of Ayurveda, Sushruta and Charaka, who carefully considered and documented the ethical values of their profession as they perform various procedures and encounter the problems in our human life. They did, within the context of a Hindu view of man, and I'll quote, is that his essential and real nature is Atman, or the self, which is immortal, self-luminous, the source of all power, joy, and glory. Everything that helps in the manifestation of the divinity of the soul is unfoldment, divinity of the soul is beneficial and moral. I'll repeat again. Everything that helps in the manifestation of the divinity of the soul is beneficial and moral, and everything that obstructs this inner unfoldment is harmful and immoral. So these were the basic foundations on which these recommendations came about. Their responsibility was to preserve the well-being of the community through maintaining the health and removing the threats to the life of the human beings and also of the non-human beings, life of anybody. And since that initial report in 1992, I had the privilege to read many more articles. This report was subsequently updated in 2007. And based upon, as a physician who practiced for 50 plus years, with collaboration with my wife, I'm going to share with you what my understanding is this morning. Now, first is the end of life issues. For us, death is considered as a most exalted human experience. At that time, there is a migration of the soul from one dimension of consciousness to yet another, a transition that we have personally experienced many times over. Death is not to be feared, neither unnecessarily accelerated, nor relentlessly delayed. You shouldn't accelerate it, and you shouldn't delay it. When this physical body dies, this automatically severs the silver cord that connects the physical and the astral bodies. We discussed about it briefly on my session on the 1st of November. Physically, death can be defined as the cessation of the breath, cessation of the heartbeat, and most importantly, cessation of the brain activity. This brain activity is best evaluated, and unfortunately I had a responsibility of carrying out those examinations, through the radionuclide studies to evaluate the vascular perfusion of the brain and also study the brainwave activity through EEG. Even then, it may be possible to revive the person, and the patient may then report a near-death experience, and the experience of the beginning, the transition to the next world, but being pulled back. How do you prepare for death? A wise Hindu facing death goes into introspection of all his deeds during the present life and sincerely tries to make amends for the wrong deeds. As a matter of fact, if you have read some personal accounts of near-death experiences, many of them will tell you after returning back, the entire life flashed in front of me. That's exactly what you do when the death is impending, when you start reflecting what has happened. And you have to make amends for the wrong deeds that you have performed. Whenever it is beyond correction, because some people have moved on, the person repents and wholeheartedly prays for forgiveness in the form of chanting mantras. He does pilgrimage to holy sites, visits temples, that is, if the health permits. When and if he becomes immobile due to physical conditions, and the indications are that he is nearing the death, nearing the end, the children and family members assemble around him and give him the holy water, either from Ganges or the holy water created, what we call tirtham, from the specially offered prayers to Lord Shiva, conducted by the friends and the family members with chanting of Mrityunjaya mantra. They sing bhajans, holy songs, chant mantras. Often there is a 24-hour vigil around, but the environment is always serene, and frequently the sacred music is playing. Sadguru Shivaya Subramanya Swami wrote, and I'll quote exact statement, "Blessed with the knowledge of impending transition, we settle our affairs and take refuge in japa, worship, scripture and yoga, seeking the highest realization as we consciously and joyously release the world and start our Mahaprasthana, the great journey. The awareness, will, memory, including our desires, vasanas, and intelligence, continue on as the subtle body. We must approach our death as a sadhana. Sadhana is a Sanskrit word, means a unique spiritual opportunity. To leave the body in the right frame of mind, in the right consciousness, through the highest possible chakra, is a key to spiritual progress. Let's talk about pain control from medical ethics point of view. We Hindus consider that the pain management as an important duty of the caretakers. If an individual opts to undergo the pains, I'm quoting one of the Swami's recommendation, that is Swami Buaji from New York. He said, if an individual opts to undergo pain, he should be left alone. Swami Bua suggests. Otherwise, it is the duty of the people around to reduce his suffering. If a person is relieved of his pain, and he says, that individual's thoughts become sublime with gratitude and are filled with the feeling of amity, affection, and love. Nobody should be allowed to die with the feelings of bitterness, feelings of wanting, or feelings of unfulfilled desires. We should do everything possible to keep the dying person comfortable till his end, which is determined only by God. End of quotes. That is from Swami Bua, who died at the age of 121. Now, opiates and other drugs have been used for this purpose for hundreds, if not thousands of years in our philosophy. And that is according to quotation from Dr. Sodhi, who is both an allopathic and Ayurvedic doctor. However, he emphasizes, as he explains, that they are not to be administered so much of that particular painkiller so as to alter or to lose consciousness of that individual. Excessive painkillers can dull awareness and inhibit the conscious transition that is really the Hindu ideal. So a person should be still lucid, should be able to connect and communicate. Then we face the situation of prolongation of life and the right to die. Now, as a doctor, disease can be curable or disease can be incurable. In Sanskrit, sadhya, asadhya. One can be conquered, one which cannot be conquered. The incurable disease is further subdivided into those which can be managed for an acceptable quality of life, such as diabetes, hypertension, and what have you, and those which cannot, as a terminal cancer. If the treatment cannot provide the patient a quality of life, then it is considered better to give no treatment beyond palliative means. That's what Ayurveda describes. It is the law of, unfortunately, sometimes whatever you want to call it, in many parts of America, our country, that a hospital must do everything possible to keep the patient alive as long as possible, no matter what is the state of consciousness or prognosis for a useful existence in the future. If the patient's financial resources are exhausted, say the laws, then the state must pay. End of quotes. To avoid being kept alive against his own wishes, the person who is about to die, that individual must make a living will in advance before he or she gets sick, to specify under what conditions and circumstances he declines further treatment, and to assign a person to make that decision for him if he cannot. This is called a living will. A living will can preserve the resources of the family, something very important, and avoid costly and ineffective heroic treatments that many of our hospitals tend to pursue. We Hindus accept the natural timing of life and death whenever possible, and do not strain to gain a few days or months of struggle and discomfort, and the life filled with that kind of struggle and discomfort at great effort and expenses. So that's the value based upon the ethical standards. But since we have to follow the rules and regulations of the country where we live, the way out and maintain the Hindu qualities is to make a living will and specify as to who your designate person would be. Well, again, we dealt with it every day in the hospital. Do not resuscitate, DNR. Again, part of the living will deals with DNR orders. These instructions tell doctors when they should not use cardiopulmonary resuscitation, CPR, or other measures to revive a person if his heart or his breathing has stopped. Again, that decision revolves around the likely quality of life so revived. What do you mean? A person who has come to me and stopped breathing following an episode of drowning, or his heart has stopped after a massive coronary heart attack, after resuscitation can go on to have a satisfactory and normal life for years to come. In that case, I'm going to revive him, bring him back. So judgmental call is based upon the quality of life that is likely to come out following that resuscitation process. But for the terminally ill patients, the resuscitation may simply delay the inevitable, prolong the suffering, and interfere with the natural timing of death. So these are the values as far as DNR orders are concerned. There are some situations where resuscitation is important, and such situation that is not there. And that also is based upon the person you have designated person to make that particular decision. Take a step further in the hospital. Removal of life support. Now, a critical and closely related issue any living being should address is when to remove that life support when the person is in the hospital, the healthcare facility. Fortunately or unfortunately, our modern machines in the hospital can keep the bodily functions going, not necessarily keeping that human being truly alive as we understand in our daily life. These sophisticated machines can keep individuals alive, in quotation mark, even when they cannot breathe or take nourishment. And life support patients may be near normal consciousness. Sometimes we put them in coma on purpose. They may be semi-conscious, comatose, or literally brain dead. Sometimes the common kidney dialysis machines and ventilators also are classified as the life support system, because if they are turned off, the person would certainly die. However, with the modern transplant technology, they do not have to an option, they do have an option to get transplant and hence don't have to die. So those, even though they are life support system, they can be maintained. From our perspective, from my perspective, Kumar's perspective, ideally, a removal of life support would be justified in a case when there is no brain activity. Keeping that individual alive is akin to torturing that soul, which our Hindu faith strongly prohibits. While our ancient Hindu scholars did not anticipate many of the abilities of the today's modern complex machine, I don't know what's the matter with Sushruta, they did not discuss the issue of nourishment. They did discuss the issue of nourishment, which was a part of any life support system even at that time. That's where Prasanna, you rightly commented. The Hindu scriptures does allow for the termination of food and water at the request of the terminally ill patient who chooses a self-willed death by fasting. And the scientific word for that in Sanskrit is prayopavesha. Prayopravesha. The individual can instruct categorically when he would prefer to stop having nourishment or even water. He lets his intentions known well in advance for several days for other individuals to act and react. Knowledge of the individual's intentions alleviates the karmic burden of the doctors and the family members and other caregivers who need to follow his instructions. Prayopavesha, or fasting to death, is an acceptable way of ending life for a Hindu in only certain circumstances. Prayopavesha is totally different than suicide. Okay. Why it is different? Prayopavesha is non-violent and uses natural means. Prayopavesha is used only when it is the right time for the life to end. It is right time when this body has served its purpose and had become a burden on others. Now, unlike suicide, it is a gradual process, allowing for the patient to prepare himself and also prepare those around him for his death. This allows for the patient to settle all the differences with others, to ponder life, draw close to God, as well as the loved ones around, to oversee the personal gradual exit from this physical world. Ideally, in that situation, that individual begins by obtaining forgiveness and giving forgiveness. He undertakes a great vow of death. It's called Marana Mahavrata, the final vrata that you can take. And it is given, that vrata is given, or offering is done to his own teacher, Guru, followed by full discussion of all the karmas of this particular life, especially fully and openly confessing one's wrongdoings. Then the attention is focused on scripture, on teachers' noble teachings. Then person tries to meditate on the innermost, immortal self, and that becomes the full focus of that person's intentions. One gradually abstains for food after that. At the very end, as soon as the soul releases itself from the body, that person tries to, and if not, the second mantra is repeated by the people around. Now, such prayopavesha is associated with the feeling of serenity and fulfillment, unlike the suicide, which is often associated with a feeling of frustration, depression, or anger. Now, there are certain specific conditions that need to be satisfied for prolongation. 1. There should be inability to perform normal bodily purification. 2. The thing can be done when the death appears imminent or the condition is so bad the life's pleasures are absolutely zilch. The decision is publicly announced well in advance. And 4, that action must be done under the community regulations existing wherever that is carried out. It's amazing. I'm referring to the studies done in 91, published in 92 by Sadhguru Shivaya Subramanya Swami. And he himself did that in 2001. Perfect example, as I mentioned, is him, the founder of Kawai Monastery. He had incurable cancer of the intestinal tract. He could not control his body functions where he could continue to purify his body. He meditated for several days, and after meditating so for many days, he announced his decision of prayopavesha to his disciples at the monastery. He accepted pain-killing medications to minimize the excruciating pains and accepted only water. He did not take any other medications or food. He moved on from this mortal existence on the 32nd day of his self-imposed fast. That is a perfect prayopavesha. It's interesting, he had written exactly 10 years earlier on the same very topic. Now we come to the topic of suicide. Prasanna, you were talking about it. Suicide or pranatyaga, that means abandoning the life force, it means intentionally ending one's own life through poisoning, drowning, burning, jumping from great heights, or it comes very easily in our country, shooting. Suicide does not solve problems. Suicide only magnifies future problems in the Antarloka. Antarloka is the subtle, non-physical world we live in before we incarnate. That is the Antarloka. And also, it has a problem in Antarloka and also in the next life. Suicide has been condemned in the Hindu scriptures because being an abrupt escape from life, it creates unseemly karma that individual must face in the future. What happens? An action of committing a suicide accelerates the intensity of the karma, bringing the series of immediate lesser births and requiring several lives of the soul to return to the exact evolutionary point that existed at the point of suicide. So because he has taken a sidetrack, he has to make do coming back again to come to the same point of spiritual advancement. And once he reached that point again, he has come back the side road and come back, he still has to face the existing karmic entanglement, face them, resolve them, and proceed. To gain a fine birth where you reach the spiritual enlightenment, one must live according to the natural laws of dharma and live out the karma in this life positively and fully. Okay. Hinduism is not black and white. Just like in radiology, there are many shades of gray. It takes into account a broader picture and allows discretion to one's conscience. One has to address several questions. One, how will this suicide affect the soul? I addressed that earlier. How will it affect humanity around? 3, how will it affect future incarnations? All these three things must be taken into consideration if a wise and compassionate and right decision has to be made on such a serious matter as this. There are very few extraordinary exceptions in which self-willed death is permitted. When everything that can be accomplished is accomplished, the state of enlightenment is reached, one can go into deep samadhi, never to come back, as was the case with Santa Jnaneshwar. So, when I'm discussing samadhi, there are about 8 different states of it. I can talk about, there are certain states in which you can reach samadhi and come back, and certain states of samadhi where your life is so complete and enlightened that person has no desire to come back. So at that time, automatically, this mortal life is exited. So that is perfectly fine. Because what is to be accomplished is already accomplished. Nothing more to be gained. And that person does not have any more karmas left. So it's not going to affect the person's soul as it's leaving. Right. It is not enough that we are unhappy, disappointed, and going through temporary anguish as the loss of a loved one, or some physical injury or personal loss. Folks, that's called life. It is the strengthening of the soul to endure such experiences. So it's a part of growing up. Painful experiences are also education. It is not enough that we are filled with sorrow or suffering some illness. None of these enough to justify suicide, and thus it is considered as an ignoble act. In almost every such seemingly insurmountable situations, there is always a solution, an answer available in due course of time. That's why one needs to be amongst the family members, friend circle, or a supportive community. We both of us feel privileged to have our temple community here as a perfect example where we can find support and comfort. And finally, I want to address the issue of euthanasia, mercy killing, and assisted suicide. I think those who asked the question last time, of course, as usual, don't show up. So that's understandable because their interest is very passing and fleeting, but that's fine. Euthanasia, mercy killing, or assisted suicide. The euthanasia comes from the Greek word eu and thanatos, and it means happy death or good death, like euphoria, euthanasia. The traditional view is that it is always wrong to intentionally kill an innocent human being, but that, given certain circumstances, it may be permissible to withhold or withdraw treatment and allow a patient to die. The process of dying is often portrayed as an invitation to the spiritual insight and a key moment in the cultivation of the spiritual identity. To die well, according to our Hindu faith, one must live well. These views of Eastern faith traditions and philosophies have been very well influential in global understanding about providing appropriate care for the dying. For example, you may have heard the pioneering work of the Swiss-born psychiatrist Elisabeth Kubler-Ross in understanding of the experience of dying patients in the Western medical institutions, which was drawn directly on understandings of the meanings of good death and stages in life, described beautifully so in the Hindu tradition. Hindu and Buddhist values of compassion, non-violence, and suffering have also influenced the discourse of Western medical ethics. The ethical tension in these two traditions, Eastern and Western, about the end-of-life choices is rooted in 3 main values: karma, liberation or moksha, and non-violence, ahimsa. These are three values on which there's a little tension. Karma, as I alluded to earlier, is the net consequence of good and bad deeds in a person's life, which then determines the nature in the next life. Ongoing accumulation of bad karma prevents moksha or liberation from the cycles of birth, growth, decay, disease, death, and rebirth, which is the ultimate goal for a Hindu. Ahimsa is a fundamental principle. Hindu Dharma proclaims ahimsa paramo dharma, meaning non-violence, non-injury, non-killing is the highest form of virtue, dharma. This concept extends to all living beings, and therefore protection of the environment, natural habitats, and being vegetarian are the natural derivatives of this concept. Now, one must not be indifferent to the sufferings of others. One must consider all living beings in the image of one's own self, and thus not commit acts of violence in thought, word, or deed against any other living beings. Thus, the practice of euthanasia will breach the teachings of ahimsa. Offering the pain-killing medications, such as opiates in small doses, so as not to allow the individual lose his consciousness, and offering him the option of prayopavesha under rigid circumstances, described earlier, is considered the most optimal option to euthanasia. I'll stop here because the next two topics that I had written was whether we should do autopsies and how to use if the bodies could be used after death, and the burial and cremation practice. But I'll stop on this topic and open up for questions and comments. Yes, Ray.
What about euthanasia for animals?
I'm glad you asked the question. The same standard applies. If, to me, when you're talking about animals, you're talking about a typical pet of yours. That pet is no different than a family member of yours. So the same value system applies. If a veterinarian can do surgical procedure which the life can come back to a near normal level, then we should do that. If pain and suffering is so intense, the disease is so incurable, the death is so imminent, and only thing the medications are going to do is just prolong the painful process before the death, which is inevitable, is sure to come, then I think that's reasonable. But that is a part where in this case what happens is, Dr. Sane, you said you have to make a living will. Dr. Sane, you have to have a designated individual who's announced. For me, in my eyes, the relationship between a pet and the person who is the master is that of interconnectedness. Whether that animal has got an attorney who has written the living will or not, that animal looks into your eyes and tells, I cannot take any pain. In that case, that is the living will as I see it. In that case, that's appropriate. Okay. Any other questions, Sukant?
Well, so in other words, so you see, the rabbit or whatever is so sick that you want to have the vet come and put them to sleep, but you wouldn't do that with a person.
The reason for that is that animal does not have the capacity to express or make choices. Human beings have been given that extra power of making choices, making logical decisions. Since they did not have it, that's why I answered the way I did. For human beings, we have the capacity to make choices. In that case, the choice has to come from that person who sees that as a terminal situation. In case that individual is not in a physical condition to make that choice at that particular point in time, and if he has made a living will in advance and designated an individual who can make that choice for him or her, then that becomes a free will as well. Does that answer your question? Good. Thank you.
There's an article I read where a dog was put to sleep. Said to the veterinarian, recommended the dog was put to sleep. The owner could see in the dog's eyes, let me go.
Okay.
So when he perceived that, then he gave his permission. So even animals have a way of saying.
Well, I mean, there's a connection. I mean, the people who don't give them enough credit for them, they are just wonderful beings.
I've had many lessons, many pets, and I've never put one down. This recently, I made the appointment.
No, I don't want you to.
I think one of the things that you mentioned, which is important, is that death is not an option. All they can do is prolong your life. If you accept death as a natural conclusion of your life, then you are at peace with yourself. Anayasena maranam, vina dainyena jivanam, dehi me krupaya Krishna, tvai bhaktim achanchalam. Anayasena maranam, death without pain. Vina dainyena jivanam, life without misery. Dehi me krupaya Krishna, with your compassion, grant me tvai bhaktim achanchalam. Achanchalam means forever. Unshakable faith in you. So if you have unshakable faith in the Supreme Being, then chanting Anayasena maranam vina dainyena jivanam dehi me kripaya Krishna tvai bhaktim achanchalam puts your mind at ease when you go to bed. When you get up in the morning, you feel refreshed. And these things have a certain effect on your own thinking. Therefore, you do not fear death. People do not fear death. What they fear is the pain that they have to go through. That's why you say, Anayasena Marana.
Well, other thing is, your point is absolutely worried about the pain. But many people fear because they have a misunderstanding that this life is all there is to it.
Yeah.
You see, if they find that they're not being able to accomplish everything they wanted to accomplish, they don't realize that they can do the homework tomorrow if you don't complete the homework tonight.
Yeah.
So, since we have a clear understanding as to the continuation of life, and we really are none different than the divine energy that exists in each and every one of us, which lives forever, then it is like, I'm unable to finish my homework today, I'll finish it tomorrow. So that there is no fear factor at all.
Yeah.
But if you've been told and you are convinced and you bought it hook, line and sinker that there is no future, either you make it or break it, then you of course are going to have fear. Because you know that you have not done a good job. You know that your life is not complete. So the fear is for pain and also because of misunderstanding.
You mentioned about living will. I think one of the things that I learned in making my own living will was not only to have that available to your physician, so it's on the record, but let your loved ones know that it is there. So it shouldn't come as a surprise to them.
As a matter of fact, what we have done, just to tell you personally,
express.
All the children have that.
Yeah.
The attorney has it.
Yeah, right.
And of course, every time you go to the hospital for any major procedure,
you get copy
no. They demand it.
Yeah.
If you have it, give it. If you don't have it, say so. Yeah. So that is automatic in every good medical institution.
So I think it's important for people to know where you keep him.
Yeah.
If you keep him in a safe with a combination lock that nobody knows, it doesn't do you much good.
Yeah, safe deposit vault, but don't keep the key. Safe deposit vault.
Yeah,
right.
It doesn't do much good.
Yeah.
Is a living will and a healthcare directive the same thing?
As a matter of fact, you're right. Living will and healthcare are usually put as a common package. It's in the same one. Yeah. Kita, you're saying something.
Okay, so
It has to be notarized and everything else.
Yeah.
I'm trying to put this together now. It is okay for an animal to have euthanasia, right? If they're in extreme pain, because they don't have that capacity.
But only person, again, don't misunderstand. Not any Tom, Dick and Harry animal.
No.
I'm talking about a spatial relationship in the master and that animal.
Right.
when just as Prasanna rightly did, I had not read that article, but I intuitively knew that there has to be a special connection between the master and the animal. That's different. Okay. And?
Now, in the case of a human, if you have this living directive that says you do not want to have any sort of artificial type of support when you are ready to go, can you put in there that you would like to hasten that process when you're at that state where you're in so much pain, nothing is helping? That's still wrong, according to our Hindu.
The answer is simply capital no.
Okay.
Because when you are in severe pain, Gita, your action or reaction is subjective. When you are making a living will, getting it notarized, it is objective. You have handed out that ball laterally to your running back, who's your designated person. He or she can decide that. You've been so overwhelmed with the subjective pain, may make a rash decision that goes to suicide many times. You understand what I mean? So that's why the answer is no. Okay.
Even if it is, you have written down that when it is that extreme that you would like.
But what is that extreme becomes subjective. You are, Bob.
Hello.
Hello. Good to see you.
Good to see you too. I'm wondering about dying for a cause, like intentional suicide. And what comes to my mind is Gandhi's threat to fast until death.
But Prasanna, don't go.
Two minds of Buddhism. Gandhi's threat to fast until death, which I think he engaged in a couple of times. And so obviously by vowing to fast, he's accommodating, I forgot the term, but it is, you didn't quite account for it. So I wonder if you, within the ethical framework that you laid out, would you comment on that?
Well, I'm glad you asked the question because you're very, very perceptive and intelligent question, something that we should address it. You talk about Mahatma Gandhi, who was an enlightened individual. He had done so much in his lifetime to educate, inspire, and get the independence to India. It was not something that he was going to commit suicide on the spot because something was not done. But he had announced that he is going to go on never-ending fast till the time the cause is fulfilled. That particular cause has been accepted. So there was enough information passed on to people around and the country at large, and also to those people who needed to make those decisions to change his mind. So it was not a never-ending situation, but giving the people in position of authority an option to take the karmic burden of death, his death, on their hands for not passing on the thing that he wanted to be passed, which in his clear conscience was the right thing to do. So that's a totally different situation. For somebody to use this when his life mission is not complete, that may not be necessarily correct. So when you give a specific example of Mahatma Gandhi, that's the way you can understand it. Okay? Yes. Oh, yes.
So our students are studying this in my class. The Tibetan self-immolations that are going on. Are you aware what that is?
Yeah.
So here's a situation where people are terribly oppressed. It's been going on for 60 years. You're dealing with people in power who are completely insensitive to their needs. And so these self-immolations have developed. And they are both religious protests in the sense that we can't practice our faith, and then political protests at the same time. In a sense, they are not inflicting violence on others, but it is an intensely violent way to die, to be burned. I mean, intensely. But it's a very conscious decision they make. I mean, they have the notes that these people write, and they thought this out.
Yeah.
And has it had an effect on the Chinese? Well, at this point we haven't really seen anything. This has a very powerful
Mm-hmm.
I wonder your thoughts about this.
Well, a couple of thoughts. One example I gave you is somebody committing a suicide, because this is a suicide. He or she is taking a little diversion, creating a tremendous amount of karmic burden on him or her. Will have to make a restitution for those karmic burdens, but again come back to the same highway once again to face the same entanglement that he or she needs to deal with. So that becomes a temporary diversion, and they may look glorified. When anything goes up in flame, it's a brilliant flame that comes out, looks glorified. But that is not the answer. To give a different viewpoint to the same thing that you asked, the leader for this particular group is the Tibetan leader's Dalai Lama. Has he committed that? No. I just want you to think about it. You can see their leader who is absolutely committed to the principle of non-injury ahimsa. He still wants to forgive them. That's the correct way of doing it. He does not have any ill feeling for the rascals who are giving him and his people a hard time. That is an enlightened individual. Even he is not committing that flaming down, flaming up the situation. That is the correct path to do. It may look a transient moment of glory, but again I told you that's nothing different than a glorified suicide, which again the person has to deal with and come back to the same highway of entanglements. Okay? Any other questions?
There's one later note. There's one way to beat death. Absolutely guaranteed. There were two women, very close to each other for all their lives. And one of them prayed and prayed and prayed and prayed. The Lord appeared before her and said, "You've been a very good woman, what can I do for you? I want nothing else. I just want to be able to attend the funeral of my dear friend." Tathastu, so be it. The other woman also prayed and prayed and prayed. The Lord came and said, "What can I do for you?" "Nothing. I've got everything. I just want to attend the funeral of my friend." Tathastu. So that's one way to beat death. But you need two people to do that.
Prasanna, tathastu.
Living will or the health directives have to be notarized?
Yes. Yeah.
It's legal. You have to get it certified. Essentially.
Yeah. And you can go to the bank, any bank, they have enough notary public, they don't charge you for it. And in case you're wondering what tathastu stands with, so be it. Okay, it's a Sanskrit word.
Very good, thank you.
Yes?
I have another question.
Uh-huh.
The Tibetan Book of the Dead describes these sort of stages after death.
Mm-hmm.
Is there is in the Hindu, works, is there something like that where, you talked a little bit about the beginnings of that.
Uh-huh.
Of course, the near-death experience may perhaps relay some of that. But is there any work that goes beyond that?
Well, I think I discussed that on 1st of November. What happens when we die. And I think that is an interesting topic, but really not important from practical person from day-to-day life. So for a small group, sometimes I'll talk with them some other time. But I would like to hear questions from the students in the back. Your professor asking that, he knows everything, he thinks. But you ask questions. Huh? Good. Yeah, exactly. Usually the warm-up act comes before the real show starts, right? Okay, ask questions, guys. Look, no question is a wrong question, because if you have a question, trust me, 10 people like you want to ask the same question but are afraid to ask. Ask, please. Yes. Anyone? Well, thank you for asking those questions. Yes. But I missed it.
10,000 elephants crushing on you.
Uh-huh.
And so
But that's probably a poetic way of describing by that particular individual. There's nothing like that. As a matter of fact, if you have a massive angina, you'll have the same kind of a crushing pain as well. So that's not necessarily a description in every particular instance. It depends on how a person is prepared to die. So I think your description is purely poetic and absolutely not true. Okay. As a matter of fact, your mind is prepared. I think Prasanna rightly said, Maranam prakriti sharinam vikrutir jivitam muchyate. Death is normal, it's inevitable, is given. What is vikruti, what is an anomaly, is that you are born at all. What I mean to say is that we being born in this particular form and shape with these genetic combination is a 1 in a billion combination. You understand what I mean? A little minor change here and there and it would have been totally different. So death is a vikruti, that's an anomaly. That we are lucky, it's a pure chance that we are born in this particular form. But once you are born, death is certainty. Shri Krishna says, Maranam prakriti sharinam vikrutir jivitam uchyate. Yes? Pardon me? I think you have to look at it in a very objective way. That was the part of experience for that human being to complete the part of the karma in this life existence. So that was the precipitating cause for that person to move on. The consequences of that particular situation is the karmic responsibility of the person who murdered him. You understand? So it's not the responsibility of the person who is murdered. That was the end phase of this particular life for that individual. And his previous karmas precipitated this as a part of the educational experience for him or her in this particular life. You understand what I mean? You had a question there.
Just about ethics and morality. How does a Hindu person, what do they use as a guide? Like other religions that have the book, like the Bible or the Quran. As a physician, what is your religion? Or are there texts that you follow? Especially some of these difficult questions around medical ethics.
Well, as I mentioned to you, our answer is not given in one particular book. It is given by the moral values and the principles that we pursue and practice. It has to be based upon desha kala paristhiti. Desha kala, that means the moral values and principles remain the same. But desha means what place you are in. Kala means what times we are living in. And paristhiti means particular situation. To have anything written in a specific black and white without having the options to use modification based upon desha kala paristhiti, it becomes like a stagnant water on a pond which collects algae. We have a dynamic way of approaching the situation. The basic principles are laid down, which I eliminated at the very beginning of my discussion. But then everything has to be based upon where you live, the times we live in, and the situation that one faces. Does that answer your question?